So the first thing I want to say before we go on, before you attack me, because I know some people will, and you have all the right to because of freedom of speech, to get through to this conversation, we have to get away from the finger pointing. We have to get away from the ideologues. We have to get away from the knee-jerk reaction names that people will call each other. Uncaring, socialistic, socialized medicine. These buzzwords are not helpful towards anyone. They're not contributing to the debate. They're just demagoguery, finger pointing, and it's not democratic. It's not bipartisan, and it's not going to help anyone. The question I'm going to pose to you is moral. Where one thing that you cannot do for yourself happens to you. Say you're in a car accident. Say your mother gets cancer. Say you fell off the roof and now you cannot walk. These are things that are not necessarily your fault. And they're not anything that you can do to change your life. I can say that I've been in one of those situations before. I had skin cancer. And it was very scary because they tell you you have to take chemotherapy, you have to go through all of these things, you have to sign all of these bills, and then you have to deal with the insurance companies. Thank goodness I had insurance. Because I would be one out of every 4 Americans don't have medical insurance. Maybe higher now due to the recession. And it may not be your fault that you don't have insurance. It may be that there has been a major life change. You may have lost your job. You may have lost your house. There are lots of reasons why people would not have medical insurance, and being in a country where medical insurance is tied to your place of work a lot of times, and I'm glad that I have medical insurance. We are bound to a system that has 3,000 prices for one procedure, has a different price for every single prescription drug, and has different people able to haggle lower and higher prices for everything depending on how big of your system is or how much coverage that you may need. With all of these variables in there, it makes it so that writing insurance is really hard. One person could have 30 different kinds of policies. If you happen to have an HMO, there may be policies for certain things and other things. And I work for a healthcare foundation, and we have medical billers and medical billers and medical billers. Lots. There are 8 in my office. There are 8 in another office. There's one every healthcare center. There's one every clinic. And they're there not to provide healthcare to you, but to push around papers and to argue with your medical providers the proper reimbursement rate. So it goes something like this, and it's kind of complicated. Mary has to go to the doctor, and she has a cold, but Mary needs to have someone stick a tube down her throat. Well, that one thing could have, 13 different prices, depending on what Mary has as medical insurance, if she has medical insurance. And that complexity makes it so that the whole system is very hard to understand. Now, the moral question I have to you is, if you're in an accident, if you have something that you have absolutely no control over, it may be your family history, it may be something that you did, it may be something that you did at all. You didn't do anything. You may fall ill to cancer, you may get into a car accident, you may have a catastrophic illness for whatever reason. On last Wednesday, I know that I have food allergies, and I went to the movies with my friend. She gave me a piece of orange gum. I know full well that I should not eat berries, but eating a piece of orange gum, you'd think, probably doesn't have berries, except for during the movie, I got itchy, and I looked at the back panel of the thing, the gum package, and it said natural and artificial flavorings, which could also mean berry juice. So I went to the hospital. I was blue. I almost died. That one decision could change my life. The one thing that could change your life could be a car accident, a heart attack, spouse gets cancer. Is it morally right that these people who may do something to themselves, like me, who ate a piece of gum, who chose to eat a piece of gum that may have something that you're allergic to, or they have absolutely no control over, like having cancer, should they have to necessarily lose their house, change their lives, lose their job because they have cancer? Should medical insurance companies be allowed to reject people for treatments that may help them? It's a complex question, but is it morally right? Is it? We have a problem with our thinking in the United States, and that is we expect to be taken care of in an emergency, but we don't want to bear anyone else's burden in that emergency. We fully expect that someone will save us, bring us to the hospital, and we won't die. But in the end, we don't want to pay for that person who almost died. They'll gladly ride in the ambulance, they'll gladly do all that. But is it morally acceptable for us not to bear the burden equally? The reason why it's so unequal is because of the different complexities in it, and it all just gets lost in the paperwork. So the question is, do we want a country that doesn't care about its citizens? Do we want a country that will help you in the short run to keep you alive, but won't necessarily help you pay for it? When you pay taxes and you pay for other things that are socialized, the police, the fire department, schools, state schools, hospitals, emergency rooms, Medicare, Medi-Cal, Social Security, we pay for these things already socially. And we don't question it. It's there. It's there just in case we get disabled. It's there in case we get old. It's there because it was promised to us. Why shouldn't healthcare be one of those things? So that's what I want you to think about. It's Ryan, the Talesend, from Los Angeles. I shall talk to you later. Bye-bye.